At least 166,000 Kenyans are infected with HIV every year, an indication that behavior change messages could be falling on deaf ears. 130,000 of those new infections are among adults, while 38,000 children are infected every year.
In the rest of the world, the transmission is almost virtually eliminated. To give you one example, in France in 2007, they had only 4 cases of HIV transmission from the mother to the child.
That number swells to 400,000 in the entire African continent. The National AIDS Control Council says that the rate of new infections in the country is worrying. For every new person put on treatment, there are at least 5 others who are infected. This grim situation partly informed the new National HIV/AIDS Strategic Plan to be launched tomorrow. The National AIDS Control Council will now concentrate on interventions that deliver results to cut down on HIV infections.
We can eliminate pediatric HIV if we adopt and fully implement prevention of mother-to-child transmission. That's one. The second one is knowledge of HIV status.
Other interventions include the male circumcision program, which provides up to 60% protection against the virus.
Fourth one is condoms, because condoms provide excellent barrier protection for HIV.
The major difference, however, between this new strategy and those before is that a budget has been created for every program to be implemented. New World Health Organization guidelines on HIV may, however, triple the cost of treatment in Kenya. One of the new requirements is to put all HIV-infected persons with a CD4 count of 350 on treatment. The government has been enrolling only those with a CD4 count of 250. CD4 count is a measure of the body's immunity. This is despite the fact that out of 600,000 people who need treatment, only 300,000 are accessing it currently. This number might double if those new requirements are taken into consideration. Yet the UNAIDS Director Michel Sidibe is worried about Kenya's overdependence on donor funding, which he says accounts for 99% of the country's HIV funding.
What we are trying to do now is to make sure also that we had a proper discussion with Kenyan government and others government to make sure that when we put someone on treatment, we know that we are putting this person on treatment for life.
Currently, the government spends 6 billion shillings on treatment of people infected with the virus every year at a cost of 20,000 shillings per person. Sylvia Chabet, Citizen TV.